Anxiety disorders are very prevalent among people in America. They affect nearly 6 million people just in the U.S. Some people are more affected and harder to treat than others. Here are some symptoms of anxiety disorders. Affective symptoms: fearful, anxious, nervous. Behavioral symptoms: behave habitually, problem sleeping, fidgeting, lack of the ability to stay calm. Cognitive symptoms: panic feelings, repetitive thoughts, difficulty focusing, obsessive thoughts or worries. Somatic symptoms: muscle tension, dry mouth, shortness of breath, heart racing, and nausea. All of these symptoms manifest themselves in different ways for specific disorders. Other symptoms of specific anxiety disorders will be given later. To break up the causes of anxiety disorders, we will focus on biological, cognitive, and sociocultural factors. Biological factors include chemical imbalances caused by chronic anxiety. For example, serotonin and GABA deficiencies lead to more anxiety. Cognitive factors include people focusing on the dangers of situations, and it makes them focus too much attention on harmless situations. Sociocultural factors include traumatic life events leading to cause anxiety disorders, for example, divorce or economic struggle. Anxiety disorders are treated by using individual, biomedical, and group, or a combination of any of these therapies, which is called eclectic. Individual therapy focuses on changing the thought patterns of these patients and gives them more homework to make the patient think about their problems after therapy. Biomedical treatment includes SSRIs, which stop reuptake of serotonin receptors so serotonin stays in the brain. Group therapy allows people to have the support system to get through their anxiety. Eclectic approaches combine treatment approaches for a more holistic approach. Now here are two specific disorders: OCD and PTSD.
Bailey, what are you doing? You asked me to clean these dishes, and I've just been cleaning them because the house is so dirty, and no matter how long I scrub it, they're never going to be clean.
Not again. We need to take you to a therapist right now.
So, Bailey, I've heard you've been feeling a little anxious and out of control. How are you feeling today?
Well, my mom made me clean the dishes, and I just couldn't get all the germs off. And they were everywhere, all over the sink.
Now, what are you thinking about, and what makes you keep thinking about the germs on your dishes?
I'm just scared of germs, and they're everywhere. Nothing kills all of them, not even hand sanitizer. Only kills 99.9% of germs.
How does your body feel when you have these panic attacks and obsessive thoughts?
I just feel so stressed out and anxious.
Out of control. Bailey, I'm going to talk to your mom now. You can sit outside. I'd like to put Bailey on a dosage of SSRIs to help correct the problem with the reuptake of serotonin in her brain.
Why do we need medication? I thought just therapy was enough.
Well, one of the leading causes of OCD is that there's not enough serotonin in the brain, and that can make her compulsive.
Will this make her less aggressive and sad?
Yes, basically it will decrease her depression and also her compulsive thoughts, so we can help get Bailey on the right track.
Okay, great. So do I need to keep bringing her back in for therapy?
Yes, and in therapy sessions we will be working on correcting Bailey's thought processes and helping her figure out why she's having these compulsive thoughts.
Okay, and do other therapists suggest this approach too?
Yes, it's a very well-known eclectic approach, and hopefully with time it'll correct the problem.
Okay, great. I'll bring her back next week. Thank you.
Hi everyone, my name's Jessica and I'm going to be the therapist leading this group session. Today we're going to be talking about the causes, the symptoms, and the treatments for PTSD, and I just want to mention that everything we say in this group is completely confidential. So now I'd like to open up the floor for anyone who wants to share an experience.
Okay. Hi, my name is Charlotte. When I was 10, I was in a traumatic car accident and both my mother and my brother were killed. So ever since then I've been having a lot of trouble. I've been having panic attacks, just turning the ignition to my car, and it's making me not able to do anything, that I feel out of control, and now I'm forced to ride my bike around everywhere.
Alright, thank you for sharing, Charlotte. Do you only have these traumatic experiences during the day, or do you also have like nightmares about it?
No, I also have nightmares and a lot of trouble sleeping.
All right, hopefully through the process of group therapy, we can help you overcome your fear of cars, and maybe you'll start to be able to go in them and not get as stressed out. So does anyone else have anything to say to Charlotte?
Charlotte, I would also like to share an experience I had as a youth. Me and my friend Steven were driving over a bridge and we plummeted into the water, and unfortunately we lost him. And I've been experiencing PTSD for a while now, and I've been going to group therapy for 6 months, and I'm seeing drastic changes in my mood and behavior, and I just want to say thank you to the group for supporting me.
So right now, it's really hard to talk about this kind of stuff, and it's really hard to be going to therapy. Does it get easier?
Yeah, with group therapy and some support from my friends and family, I've really been coming through this harsh time in my life.
All right, thank you both for sharing. I think now would be a great time for a quick break.